Both the couple have to do their thyroid test, and women has to check their egg stock level and men have to check their semen analysis. Usually in a IVF cycle, we expect around 5 follicular growth in each side of the ovary. This will increase the chance to conceive. So 14 to 16 hours post rupture injection, you have to do certain blood test and urine test to confirm that the rupture injection has acted in the body. Next, after your rupture injection, around 34 to 36 hours your egg pickup will be done. So you have to make sure you reach the hospital 1 to 2 hours before your egg pickup. If you are going for a frozen transfer, you need not worry about the endometrial thickness. Hi, this is Dr. Reshma Shree, fertility super specialist. Today let's discuss about basic steps of IVF or ICSI procedure. Any couple, before planning their ART procedure, they have to complete these 5 basic procedures. First is a basic blood test. So in your basic blood test, we will be checking your hemoglobin, your platelets, your WBC, your serology, your blood sugar. So following that, you have to do, both the couple have to do their thyroid test, and women has to check their egg stock level and men have to check their semen analysis. So on day 2 or day 3 of a periods, where before starting your hormonal injections, you have to do your basal scan. So in your scan, if your egg are good, there is no cyst in your eggs and your antral follicle count will be counted, and then your uterus will be checked. If you are going for a frozen transfer, you need not worry about the endometrial thickness, whereas in case of fresh transfer, the endometrium must be thin, that is around 3 to 4 millimeter. So if all these criteria are good, then you can start your gonadotropin injections. So your dose of gonadotropin and the type of injection must be decided by your fertility specialist. There are 3 types of gonadotropin injections available. One is urinary gonadotropin, second is highly purified gonadotrophins, third is recombinant injections. So based on your financial status and your health status, your dose can be decided. Same injection dose will be given for next 3 days. Scan need not be repeated. From day 5 of your gonadotropin injections, your estradiol test will be done and your follicular monitoring will begin. So once the follicular monitoring is begin, your dose will get titrated according to the growth of the follicle. Usually in IVF cycle, we expect around 5 follicular growth in each side of the ovary. Minimum at least 5 follicle must grow. So totally at least 10 follicle growth will be attained. This will increase the chance to conceive. So when the number of egg grown is reduced, the chance to conceive also gets reduced, and your dose and the type of injection should be planned accordingly. So once the follicle grows around 1.8 to 2 centimeters, at least around 2 to 3 follicles should be matured, then you can get your rupture injection. So 14 to 16 hours post rupture injection, you have to do certain blood test and urine test to confirm that the rupture injection has acted in the body. So it is very important to take your rupture injection at appropriate time and in the appropriate way. So next, after your rupture injection, around 34 to 36 hours your egg pickup will be done. So you have to make sure you reach the hospital 1 to 2 hours before your egg pickup, and you should be in fasting for around 6 to 8 hours. So after you reach the IVF lab, you will be given IV sedation and your egg pickup will be done with the help of scan vaginally. So post egg pickup, the eggs will be monitored by embryologists. Maturity and the quality of the eggs will be assessed, and then the sperm will be prepared. The husband's sperm will be prepared according to IVF or ICSI procedure, and the procedure will be carried out. So post IVF procedure, and the growth of the embryos will be monitored. So once, if you are going for a fresh transfer, you can transfer the embryos either on day 3 or day 5 based on the quality and your body condition, and you can plan your pregnancy accordingly. So if you are going for a frozen transfer, you can take a break of 1.5 months, prepare your endometrium according to a natural cycle and plan your embryo transfer of day 3 or day 5 embryos according to your embryologist opinion and your fertility specialist opinion. So today we have discussed in detail about IVF or ICSI procedure. So any couple, before entering an IRT program, they have to understand about the pros and cons, the success rate about the procedure. So if you have any further doubts, please contact the helpline number. We can give you detailed counseling and treatment regarding IVF and ICSI. Thank you.